just to remind everyone, the purpose of the study is to provide the greater Metro West Jewish community with reliable information to help all of us, those of us who are involved at Federation, but also throughout the Jewish community of our area, to be able to better fulfill our mission, to care for people in need, to build a vibrant Jewish community. We haven't collected this sort of data in the greater Metro West area in New Jersey for over 20 years. So the Federation leadership really thoughtfully invested in a state-of-the-art research study to learn about ourselves. We engaged the Maurice and Marilyn Cohen Center for Modern Jewish Studies at Brandeis University, which is a renowned multidisciplinary research institute dedicated to the study of American Jewry and their religious and cultural identity. The community study, like I said, is hot off the presses this week. It was released on Tuesday, and it's available on the Federation website. Hopefully all of you got the email with the link. We're going to send it out again after the meeting tonight, so you can go, and the entire community is able to read the reports that the Cohen Center developed. This evening, we're inviting you into the conversation. We're really pleased that Janet Aronson, the lead researcher on our community study, is here with us tonight. She's going to share some details of how she went about this amazing project of the community study and a selection of the key findings. And then there'll be time for all of you to ask her some questions about the data, either if you've had a chance to read it in the couple of days when it's been released, or if she's going to share a lot of cool information with you tonight, ask her any questions about that. After we hear from Janet, David already said we're going to turn back to him, and he'll share a little bit from Federation's perspective about what we're thinking about this is all meaning at the Federation. So now let me introduce Janet Aronson, PhD. She is the Associate Director of the Cohen Center for Modern Jewish Studies at Brandeis University. She earned her PhD in social policy at the Heller School for Social Policy at Brandeis. Janet has directed and contributed to local Jewish community studies in over a dozen communities, including recently the study of Chicago that was released this month, and most recently, the study of Greater Metro West New Jersey that was released this week. Janet is happy to be learning about her home community in Metro West New Jersey. She grew up in Union and is a proud graduate of what was then called the Solomon Schechter Day School of Essex and Union, and now we lovingly call Golda Ach Academy, when it was housed, for those of you who remember back then, at the Green Lane Y in Union. So we welcome Janet back to Greater Metro West and turn it over to her to share the results of the study.
Hey, thank you, everyone. While I share my screen, I want to just begin by introducing the director of the Cohen Center, Len Sachs, who is on the call with us, and he's going to provide a few framing comments. Then I'll present the data, and then we'll open it up for Q&A, and he'll share that with me. So go ahead, Len.
So thank you, Janet, and thank you, Ben, thank you, David, thank you, all of you, for being with us. This is a really wonderful moment for us where we get to share the results of some hard work over the last 2 years. I regret that we weren't able to spend more time in the community. We got in just before COVID, but hopefully we'll have other opportunities. I'm also a Jersey boy by birth. My early years, a little bit further north, but I know Metro West, the greater Metro West area well, and so it's been very interesting to work on the project. So just a word about the Cohen Center. We are about accuracy, we're about doing rigorous research, but we're also about doing actionable research. And so it's particularly exciting for us to be at this moment having a discussion with you about our findings, but also how they can be used. I'll turn it back to Janet now. I want to use our time as best we can, and I'll come back in when we're in the Q&A. So Janet?
Thanks. Thanks, Len. I'm going to go fast. So I'll warn you, there is so much data in the report, and even more that we collected in the study that's not in the report. What I'd like to show you today is some of the findings, sort of a snippet from a sampler from different parts of the study, so that you'll have a sense of what the richness is, and a little bit of some of new concepts that are in the study that I think if we have a chance to talk about them now, it'll help you appreciate some of the innovative work that we've done. So just in terms of framing, as you read the reports, just sort of a word of caution is that the story in the data is not necessarily the individual numbers, the data points. It's a survey, so every number is an estimate. It's not an exact, precise, this percentage of all people said this, but what we're really looking for is patterns and stories in the data. And we often look at that by saying, where are the interesting differences between people who live in different regions, or people of different ages, or people who have children and people who don't. So that's one of the focuses to think about as you go through the data. And we'll be talking about some of those tonight. A couple of words about how we did the study. It is a sample of over 3,000 respondents from Greater Metro West. We conducted it between October and December of 2020. That was pretty much in the heart of the pandemic. And I think that on the one hand, kind of colors some of the things that we did in thinking about participation, how people participated at that point of time. But it also shows some opportunities and some new things that people were doing. We have a lot about online Jewish life and some new things. Briefly, it was a random sample from organization lists, purchase data lists. Because we have a large number of respondents in the survey, this over 3,000 is a relatively large number. And we could do a lot of work with looking at subgroups and looking at those differences that I said were so important. And the overall response rate was over 33%. We were very happy with that. It's very, very high compared to other similar surveys that are being conducted these days. So now on to the findings. How big is the community? This is always the first question. So there are over 122,000 Jewish individuals in Greater Metro West. I'll talk in a moment about who is a Jewish individual, but they live in almost 57,000 Jewish households, where a household is a group of people who live together with at least one Jewish adult. Now, of course, many of those households include non-Jewish people. So altogether, if you think about the expanded community, 155,000 people living in Jewish households in Greater Metro West. It's divided between adults and children, and you can see the numbers here. Jewish adults for this study are defined as people who identify as Jewish, either they say their religion is Jewish, they're culturally Jewish. Some of them say they're Jewish and another religion. In addition, they all have said that either at least one of their parents is Jewish, they were raised Jewish, or they converted to Judaism. This is a pretty standard sociological definition of what it means to be Jewish. Obviously, there are a lot of other definitions you could use. For children, this is a little simpler. If their parents consider them to be Jewish, they are Jewish. So that's a slightly different measure. Here's a map of the community. And when you look at the report, you could zoom in and see a little bit closer. We've divided the area into 4 regions. It's the Essex and Union County, along the county lines. The eastern part of Morris County, which is more densely Jewish than the western part, and then a combination of the western part of Morris County and the rest of the region. So you can look at the distribution of households, and you can see that Essex has the largest share of Jewish households. About 38% of Jewish households are in Essex. A quarter are in East Morris, and the rest are divided between Union and this large purple area, which we're calling Western Greater Metro West. In terms of age, it's probably not surprising that the Jews in Greater Metro West are a little bit older than Jews on average. This is the age distribution of Metro West. This, the bottom is of all US Jews, and the bottom row is all US adults. So what is one of the distinct characteristics of Greater Metro West is you're not don't have a city, you don't have a large young adult population. And I think that that skews the, that's reflected here in the data. Just a little example of some of the regional differences that we detected, and this is kind of frames much of the conversation in the report, is one of the things that jumped out right away is some distinctive characteristics of Union County. You can see that this just shows the age distribution within each county. And you can see that almost half of the Jewish adults in Union County are under age 50. And that's much younger than any of the other regions. In the other regions, the big bump is this 50 to 64-year-olds, and about 40% of the people are in that age group. Another characteristic that kind of goes along with the same story is that there are many more Orthodox Jews in Union County. 10% of Jews in Union County are Orthodox, and compared to 4% or less in any of the other regions. Now I'm just going to go through, variety of data points, and they're all worthy of discussion on their own. This shows about marriage and children. Most Jewish adults are married or partnered. As I said, not too many young single adults. Of the ones who are married and partnered, 33% are intermarried, married to someone who's not Jewish. That is lower, quite a bit lower than national averages, which is 42%. However, when it comes to children, it's a slightly different story. Thinking about just Jewish children, about equal numbers of them have in-married parents and intermarried parents, and 8% have single parents. Turning to Jewish denominations, we'll go through some measures of Jewish engagement now. So the share of Jews who are Orthodox is less than the national average. Conservative is more than the national average. Reform is about the same. One of the trends in the United States, just in the American Jewish community in general, is the rise of people who say they have no Jewish denomination. So in Metro West, that's almost 4 out of 10 say they have no denomination. About half say that they are secular or culturally Jewish, and half say that they're just Jewish. And this is even higher than a little bit higher than all US Jewish adults. So there's a lot of interest in that group of people who don't identify with the denomination. And we'll talk in a moment about how we can understand more about their Jewish identity. Another measure of Jewish identity, synagogues, service attendance. So 31% of Jewish adults are members of a synagogue. That's just about the same as the national average, but a higher number, more than half, attended a service in the last 6 months. This is a good example where we might think about COVID impact, because we included both in-person and online services. And an interesting question is, might some of those people have attended online where they wouldn't have attended in person? But this is just what the numbers I just gave you were people. This is about households. So about 30%, almost 30% of households are synagogue members. And most of them are members of what we call a brick and mortar synagogue. That's often what we think of as synagogues, with a building and a clergy and dues. Another important measure of Jewish engagement is school and camp enrollment. 30% of Jewish children, preschool age children, are in a Jewish preschool. That's actually a relatively high number compared to other communities, some other communities, but there's no national data to compare this to. 20% are in part-time schools, 7% are in day school. And bottom is showing us about camp. For camp, we looked at 2019 or 2020 because the attendance in 2020 was so low. I want to turn now to sort of a new concept and that I want to present to you about Jewish identity. So as I mentioned earlier, 4 out of 10 Jewish adults don't identify with the denomination. So it really makes it hard to kind of make sense about what does Jewish engagement look like. Another problem with denominations is that they really focus on ritual behavior and they don't account for cultural behavior and communal behavior. So we've developed a way to classify, or a typology of Jewish engagement that includes ritual behavior, communal, personal behavior, things like donating to Jewish organizations, attending programs, following news about Israel, reading Jewish books on your own, things like that. And we've put these set of 18 behaviors that we put together statistically and identify the patterns. What kinds are there people who do a lot of ritual behavior, but not other things? Are there people who do cultural, but not ritual? And putting them all together, we developed a typology of 5 groups. These are specific to Metro West. These are not labels in the report. You don't say which group you're in, but these are derived from what behaviors people say that they do. And we find 5 groups in the community. The largest groups, more than a quarter of each group, are in the middle. We call that one is what we call personal. Most of what they do in Jewish life is on their own. Things like, as I said, talk about Jewish topics with their friends, read Jewish books, and so forth, and not as much in communal or ritual life. Then there's another quarter where we call them familial, because what they're doing is the holidays that they celebrate with families, typically Passover Seder, Hanukkah candle lighting. These groups, immersed and involved, have high levels of engagement in Jewish life. Immersed, they do kind of all of those dimensions of Jewish life. Involved also do, but a little bit less of them. And 16% are minimally involved. That means they really don't do much in terms of Jewish life. The purpose of this typology is not to evaluate people. It's not really to compare. It's really just to explain and understand what is going on in the Jewish community. So how does this differ from denomination, just to clarify the point? Well, on this row, we see that Orthodox Jews, 84%, vast majority, are in this immersed highest engagement group, but 15% of people who say that they are Orthodox, actually most of their Jewish life is at home and not in some of our synagogue life. That could be affected by COVID. But what I really want to call your attention to is this group, the no denomination, almost 40% of people, and looking at the range of Jewish engagement among people with no denomination. They fall in every category. A few more topics that I want to hit on: philanthropy. About 2/3 of households donated to at least one Jewish organization last year. 19% donated only to Jewish organizations. And this shows a list of what organizations they donated to. So we have 10% of households donated to Federation last year. What are people interested in? What's driving their donations, their volunteering? This just asks, what causes are you interested in? And we asked them, they could select 3 from this list. And these are the ones that people chose. So fully half of people chose as one of their top 3 causes, human service, social service needs, followed by social justice, environment, and healthcare. So this may be important for thinking about what are people concerned about. Turning to membership in Jewish organizations, you can see that 4% are members of JCC or Y, 12% are members of a formal organization. It might be like Hadassah, something like that. 12% could be some of the same people, are members of an informal group, that might be a book group or a social chavurah, something like that. But one thing that's striking, and I think if you know trends sort of in general in Jewish life and in the general world, the people who are older are much more likely to belong to organizations, both formal and informal. And this is where we see a big age difference between the groups. We asked a number of attitude questions that also will be really helpful in understanding Jewish life and people's concerns about it. But one of the things we asked is, how satisfied are you with your connections to the local Jewish community? And if you were fully satisfied, we didn't follow up. But if you were less than fully satisfied, we asked, what are the kinds of things that limit your connection to the Jewish community? And these are the answers that people gave. And the top two, which is the bottom of the chart, is the people said they haven't found interesting Jewish activities and the coronavirus crisis. Hopefully that will get resolved on its own. But the question about Jewish activities will remain. In the middle, about half of people said they don't know many Jewish people, and they're not confident in their Jewish knowledge. And when I talk about this, I like to remind everybody that it's not always that they don't have a lot of Jewish knowledge or they need a lot of Jewish knowledge, but it's something about they don't feel that they have enough Jewish knowledge to fully participate in Jewish life. So this is almost as much about confidence and being welcome to people at all levels than actually their actual level of knowledge. I'm going to share a little bit of information about the this well-being and the social situation of households. And over here, we asked people to describe their standard of living. 2% of households said they cannot make ends meet, and 15% said that they're just managing to make ends meet. This group together, 17%, we refer to throughout the report as financially struggling. So I would say 17% of households are financially struggling. And we also found that we asked questions about the COVID impact, and the households that were financially struggling were hit hardest by COVID in every way: decline in income, decline in jobs, and greater needs for services. The last thing I want to share is just about health issues. 19% of Jewish households include someone with a chronic health issue that limits their daily life. And this just shows the largest groups are chronic illness and physical disability. So we have other information about what kind of services they need and what kind of services they receive and where they get them. So that's all in the report. And that brings me to the end of my quick presentation, and I welcome your questions.
Thank you, Janet. We're going to turn now to Q&A. And what we're going to do is offer you a variety of ways to get my attention to ask a question of Janet. You can wave your hand in your camera screen, and then I'll know to put you on our list. If you know how to use and want to use the raise hand function of Zoom, you could do that. Good, Gary, you did it already. And if you prefer not to speak on camera or on audio and want to just type your question in the chat, feel free to do that as well. One thing to say about what is a good idea to ask Janet about and what's not a good idea to ask Janet about. It is a good idea to ask Janet about any of the slides that she shared and any of the data points. You could say, please go back to this slide and tell me more about that. You can ask her about the methodology of how they did the study. And if you've read the reports and you have a question about a particular point in the report and you can point us to that point in the report, please ask Janet about it. Please don't expect to ask Janet to have memorized all of the data in this massive data set. She did a great job of putting the data together and having these reports with her team, but she hasn't put it all to memory. So if you have a question that's just like, what's this particular statistic? Janet probably won't be able to tell you right off the top of her head. So, but if you do have something in the reports you can point to, she could definitely respond to that. So I see a bunch of people who've already raised their digital hands. So let's start with Gary, and then I'm taking down names. Stacy and Ed, you'll be on deck. Gary, why don't you just go off mute and question away?
Okay, you hear me?
We do.
Good. So 2 comments, which I would ask you to in turn comment on. One, while it's been a long time, my recollection is prior to the merger, when it was just Metro West, we always threw around the number of 120,000 Jews. And with the addition of Union County, that number probably that we were working with was somewhere, I would think, 140, 150,000. And the number that I saw was in this report was back around 120,000. So so I'm asking for a comment on, the trend of the community. And then the second item is just surprise at the small number or the small percentage of Orthodox members of the community. And if there's, some thoughts about that, and whether there's any possibility that the sampling somehow missed the Orthodox community or underrepresented the Orthodox community.
Okay, thanks for your questions, Gary. And Len is going to help me answer questions, so I'll ask him to just jump in whenever he'd like. But to your specific question, we honestly, because of the length of time since the previous study, we didn't really concentrate on doing a comparable. And as you said, the change in geography. It's really hard to tell if the trend has been a consistent rise over time, if if the numbers were right then and there's been a decrease and an increase. Honestly, it's just impossible to answer that question. I think that I'd look at this as a snapshot in time and a kind of a new baseline to go forward with. But it is important to get the numbers as accurate as we can for today. So to your question about Orthodox Jews, I think it is possible that it is a little bit higher than we said, or it's probably not lower. But when we said 4%, and as I said earlier, there's any number like that, there's sort of a range around it. It probably could be as much as 8%. I don't really know that range off the top of my head. But what often happens is, particularly with Orthodox Jews, because they're concentrated, they live they're not equally distributed throughout the region, that they live in certain parts of the community. And so in those communities, and where they're Orthodox Jews, it's much higher than 4%. But if you look at the whole region, including way out in the western part of the region, and you account for everybody, I think that this number, so if it's so let's say 4 to 8%, I feel very confident in that number. And it's one of the reasons I'm a little reluctant to even put it next to the US Jewish number, which was 9%, and it looks like, wow, that's so low. But basically, those numbers are not very far from each other. And I want to emphasize that as we look at numbers.
Thanks, Janet. Stacy.
Yeah, thanks, Janet. Thank you for your presentation. I don't know, did you have the opportunity or did you look at the study from 20 years ago? Because my question is, are there any things that are remarkable difference-wise between 20 years ago and today?
As I said, unfortunately, I actually did not. I mean, I looked at it when we were at the beginning in the planning process, but really the direction was, given the changes in the geography, the changes in time, the changes in methodology, the changes, the survey questions were different. There was so much that was different that it's just not apples to apples, unfortunately. Thanks,
Stacy. Ed.
Yes, you went very quickly with that very last chart on the health issues. If I'm correct in my quick reading, it sounded or looked like we have a very much larger health challenged community than the national average, or did I just read it wrong?
If you're looking at the two columns, sorry, that was not the national average. This is another one where there's no national numbers. What we showed you was It's a little hard to read.
Can you bring that back up again,
I will
Janet?
bring it up. Yes, I just
Thank you.
got to that just to show you. And while I'm bringing it up, just to point out, in the reports, there are a lot of numbers. We try to make it as clear as possible and label everything, but I know that it can be confusing. This is the percentage. So we said that 19% of households include someone with a health issue. So this is among that 19%,
I mean,
almost
90
half of them have a chronic illness.
Where is the 19?
Up here.
Oh,
19% include someone with a health issue. Of that 19%, almost half of them have a chronic illness. So that means 9% of all households. So this is not. Yeah.
That last column I thought was all Jewish.
Yes, yes.
It
Often
sounded
it's
like we have a very sick community.
Oh, yes. Yeah, that would be bad. But thank you for giving me the chance to show that, because that's an important distinction.
Okay, great. Thanks, Janet. Thanks, Ed. Paula.
Okay, thank you. And thank you, Janet and Len. Two questions. One is, we've always considered Greater Metro West, when we talk about it, we talk about counties, Essex County, Morris County, Union, Sussex, and parts of Somerset. I think I have that right.
Mm-hmm.
I saw that you divided the map by Western Morris. So I wanted you to just comment on how you came up with that mapping. My second question is, I was happy to see that only, I think it was 4% feel like they're not included or don't feel included in our community. So that was good. But I would like to see the graph again of what people are most interested in, because I was surprised that Israel seemed to be, it went quickly, so I didn't see it for that length of a time, but it seemed to me that Israel was not very high on everyone's interest. And I was wondering if you've noticed that in other communities, or just to comment on that, and whether or not the human services and social services, did that include Israel and other countries around the world, or is that just local social services and human services?
Okay, great questions. And I'll also share the screen again, just so that we're all looking at this together. The map, you're right, the county lines this doesn't follow the lines. Some of it is methodological. Some of it is sort of more substantive. I'd say in order to do this analysis, we needed enough respondents, actual respondents in every region, to be able to give you an estimate of what's the behavior in that region. And because these other counties, the Sussex and part of Somerset, really don't have that many Jewish households, we needed to sort of borrow Western Morris County to make it a big enough region so that we could tell something. But we spent a lot of time really thinking about where does this line make sense? And we tried a number of combinations with a lot of trial and error with getting enough respondents. But really, there was a feeling that there's a difference in this kind of the Jewish culture of eastern and western part of the county. And the eastern includes Morristown and some denser areas. And exactly where the line should go, we tried a few things. And as I mentioned, I grew up in Union, but my parents were living in Rockaway at the time, and I was like, oh, I know exactly where that line is. But that's Rockaway is on this side, Dover's on the other side, and so that's the main reason. But even if you look at the density, and I'll point out the red dots each represent about 25 households. They're obviously not exactly at that dot, but it gives you a sense of the density. And you can see that the density in this part of the county is a lot higher. And there are a few blips here, but all of this area kind of looks more similar to each other. So I think it worked out pretty well in terms of in terms of the characteristics of the regions.
So-
Yep. Did
Do
you
you
want
want
to
me to
follow
take
up or?
Do you want me to take the Israel question?
Yes, I was just going to this slide.
Right.
Yeah.
So I think it's a bit about how the question was asked, which caused you, which three causes are the top ones that you support or you care about. And what you see here is that people care about human service and social justice and environmental issues. That's at the top of people's minds. As a student of what's changed and not changed about attitudes to Israel over the past several decades, what's happened is that as Israel became the startup nation, as Israel became not a country of poor people, but a well-off country, some of the reason that it was at the top of people's lists in earlier times has changed. And also, despite both the existential and the actual threats that Israel faces on the north, on the east, on the south, security challenges, Israel is perceived as a strong and powerful country. I don't think, and I think this is where we have to be careful about how we interpret these data, I don't think it means that people don't care about Israel or they don't highly support Israel. It just doesn't present, if you will, the human needs issues that Israel not so long ago represented.
I also want to add a reminder of the time that this survey was in the field and what was on people's mind. Human service needs, politics, social justice.
Right.
And that was really foremost. And you know, if there had been a crisis in Israel at that time, maybe something would have switched. So it is really a point in time. And that was a very
And now that I see the chart, it's interesting that Jewish life is actually so low on this as well. You know, these are our priorities within our federation. Is
Yeah. Thank you, Paula. We're going to turn to Lynn.
Okay, this is a follow-up to the information elicited by Paula's question. Can you put that chart with the purple and so on back up?
the chart with the map.
The map, yeah, the map, which is not counties, but is, yeah, that one.
Mhm.
Okay, so I understand your explanation that you needed a critical mass of people in any of the given quote unquote areas, not counties.
Mhm.
But if you look at the yellow and how the Jews in the yellow choose to live among other Jews and Jewish institutions and Jewish whatever, you know, a kosher butcher, you know, a Jewish deli, and you look at the people who have chosen to scatter themselves in the purple, and if I assume that you gave equal weight to every single respondent, irrespective of where they live,
Mhm.
it does appear to me that at least a quarter of the responses have come from people who, by their choice of where they live, of with whom they interact, of the institutions to which they go, have chosen pretty much to opt out of Jewish life. And yet we're using that as a criterion for an overall feeling of the Jewish community to the various categories that you have. And I wonder whether they are, by their chosen lifestyle, by what they're saying about their identification with their Jewishness, whether they are skewing what we think the rest of the Jews feel like.
I think if I can answer that
Sure.
question or respond, I think it's slightly more complicated, and I take it from the other side. Where people live is not simply a choice. That economics are a major determinant of it. And many of the people who live further out from the Jewish community are making that decision not because they want to separate themselves, but in order to have the schools or the size of house or access to a job or whatever it is, they've moved away. And I think especially in northern Jersey, the economics of housing costs and real estate taxes and so on have governed that. Yes, people in Essex County live closer to one another, and part of it may be a choice about being close to a community, but that's not the whole story. We wanted to organize people because geography is important, and especially given how difficult it is to get even from areas that are relatively close to another. There's depending on the transportation lines and highways and so on. But this was our attempt, our best attempt, with working closely with Federation staff to come up with some meaningful areas.
I want to just add to something. I think that's absolutely right about the thinking about the geography, but just a sort of the wonky statistical part is this is not the distribution of the 3,000 people who responded in the survey. It doesn't mean that they don't each count for the same amount in the survey. It's very different, and the whole it's called the survey weighting process, which is very complicated, and I can talk to anybody about it offline, is taking those 3,000 responses and adjusting them to count for the right number of people in the whole population. It's not exactly the case that a quarter of the respondents came from each area and then we treated them the same. That's what makes this work so challenging, because we know that there are people who are easier and harder to find for the survey and more or less likely to respond to the survey. And that's really the art and science of it.
Thanks, Janet. Thanks, Len. Thanks, Lynn, for that question. Steve, you're going to get the last question tonight.
Thanks, Ben. I think we've all, anybody who follows politics has seen the concern about inaccuracy in political polling. And a lot of that is tied to the way data is actually captured. What's the methodology you use to capture data? Was it telephone? Was it limited to landlines? Did it include cell phones? Was it by internet? Was it writing? And there's so many methodologies you can use. And the world is changing as we speak right now in terms of how people communicate. So what was the methodology you used to accumulate this data?
So we used a variety of methods and extremely complicated. We've been working on these techniques for the past 20 years. And as to pick up on Janet's last response, we used a set of weighting techniques. And one of the bases of the weighting is a synthesis of national studies using everything from what is called address-based sampling to random digit dial telephoning. We contacted people in different ways, but we used multiple methods. And we are pretty confident, we're very confident in the overall numbers because it matches the basic information that's been collected by hundreds and hundreds of studies. So this is not just a single study. We also use benchmarking data, actual data of synagogue membership and day school participation, et cetera, as weighting factors. It is exceptionally complicated to do this. It's hard to do it accurately. We think we've gotten better and better at doing it accurately, and we have some ways of measuring that. But finding Jews, because the census doesn't measure religious identification and ethnic identification in a way that would be useful to understanding the Jewish community, makes that really difficult. This is my standing on one foot explanation. We have dozens and dozens of technical monographs and scholarly papers that describe the methodology. The simplest way of saying it is it's multiple strategies and then adjusting it based on known information about the Jewish community.
Thank you, Len. Thank you, Janet. Thanks, Steve, for that question. These were great questions, and I'm sure there are more. As you think of them, if you have more questions about the study and you want to dig deeper, feel free to send them to me, and we're happy to keep the conversation going in the weeks ahead as we dive into this data. And so I'm going to actually share for a couple of minutes what we're thinking about how to use this data at Federation. So we're thinking about, all of this incredible, massive amount of information that Janet and Len and their team have gathered about us and our community, and we want to think about how we can use it. Like I started, the purpose was really to give this information, the best accurate information we could have about ourselves and our community, to help us strengthen our community. So we are sharing these reports widely. As I said before, they're out on our website so that anyone in the community can read the reports. And we sent them to all of our partner agencies and synagogues and institutions and invited them to join us. And this is the first, you guys are getting the first of our tour. Jan and I are going on a tour of about a dozen different informational meetings in the community that are available for different constituency groups. So I have a meeting for people who are engaged in synagogues, and for folks who work in social service agencies, and for folks who do work in the JCCs, et cetera. We also have some meetings that are divided by those 4 geographic areas. To Lynn's question about what, they are different clearly on that map. Those differences are also reflected in the data set and the analysis. So people can choose which informational meetings they want to come to. And actually, you're all invited. If you're interested in hearing this data cut in different ways and hearing Janet answer more questions from different perspectives, all of the registrations for those meetings are on the website. Please feel free to join us. We've also been thinking about, from a Federation perspective, what are we going to do with this data in our Federation? And there's big picture thoughts. The Federation leadership, the senior management team, the executive committee have already been looking at trends across the study reports to try and identify priority areas. And in a moment, David's going to tell you some more details about that big picture thinking. But before I turn it over to David, I just wanted to say that there's also details, right? The folks who work at Federation, like myself, partner with many folks like you, the lay leaders in our community, to do all sorts of ongoing work in our Federation that supports our community. And so the Federation staff is going to be working in partnership with the volunteers to look at the details of each given program that we run. How could we utilize this data to help strengthen what we're doing in our day-to-day work? So with that, I'm going to turn it over to David to say a little bit more about the big picture thinking about next steps.
Okay. Am I unmuted? I am. Okay. Thank you, Ben. And thank you, Janet and Len. We really, really appreciate it. And just for the rest of you, Janet and Len are, I think maybe more so Janet, are going to be available, for us at all of these meetings, so that the questions can be asked and we get them. And Stephen, I was scurrying to try and find, although I couldn't find it quick enough. When you go on to the documents on the website, I believe, I could be wrong, but I believe there is a section about the methodology, getting a little bit more specific in terms of, like you were saying, were the emails, were they phone calls, were they, whatever the case may be, I recall.
Yeah, there is, David. It's called the technical appendix, and it's massive.
There you go. Okay. which is why I didn't read it. All right, so first of all, thank you again for everybody who was on this Zoom. You know, as you can see, there's a lot of content here. And I want to remind everyone tonight, this is literally the beginning of the conversation. And I love the questions. There are a lot of things that are in this study. They're going to pop out for different people. And as our major stakeholders, we really, really welcome your input. And I encourage you, as Ben said, to meet with me or Dov or Ben and Cheryl Perlstein, who is the chair of this study, to learn more. And we hope that everybody on this call will participate in one of the many task forces that we're going to have. So as Ben said in the last couple of minutes, you know, what does this study mean for the Federation and our work? You know, what's next? Because what we're talking about when we put it out to the community, we are going to be developing and assisting how we're going to mix things up in terms of service areas, geography. There are so many different things that we are going to help our agencies and synagogues and other organizations align with each other to tackle these issues, to help them chart a path for their individual agencies, but that will have a common theme that flows through us. So we're going to be developing the Federation several task forces to help provide solutions for issues identified in the study. And I'm going to go over 5 of them right now. Dispersing. We saw in the study that Greater Metro West is widely dispersed with a brand that is not consistently strong across our catchment area. To begin with, our building in Whippany isn't located, if you looked at the map, in a particularly dense Jewish area. We're going to want a task force to help us rethink our whole central institutional location and how our physical footprint and operations might look throughout our catchment area in the future. Welcoming. We have to think through how to upgrade our concierge and welcoming programs into a single holistic platform that builds on our existing programs to touch people who arrive in our community and to help them find their way. We have a lot of sprawl, while proactively at the same time encouraging a smooth and friendly transition. For example, how do we re-welcome empty nesters, in addition to longtime residents who feel disconnected now? And getting into connecting and valuing, we have many disconnected, alienated, disengaged, unaffiliated, marginalized, and rejected groups of people. These include LGBTQ, interfaith families, Jews of color, people with special needs, singles. We need a task force to design strategies and guidelines to ensure that Federation is connecting with and valuing all of us. And the aim of this task force would be to widen our understanding of what it means to engage all different forms of affiliation. What can we offer? Making sure our tent has touch points and access points for all. What do we need to change in order to be this place that we want to be? So in addition to these first 3 task forces, which are kind of big picture and focused on major themes, we're recommending the following 2 based on issues that arose from the study. One we're calling the moonshot. Okay, what we're looking here is at a UJA campaign think tank tasked with brainstorming, testing, and presenting solutions that will enable us to double the donor base within 5 years. It's a big and exciting goal, and it ties in well with the question of where we are heading immediately after our centennial. And the last one is the safety net, a public community service. We always have acronyms, the PCS, task force to be organized to focus on the areas of poverty, hunger, and economic need in our community, bringing together agencies and organizations focused on these issues and opening an ongoing dialogue with them with the Federation. It's a lot to digest, and the time frame is intentionally, for lack of a better word, not short. We need to allow each phase to work through the process, so when we come out at the end, we'll have developed a comprehensive strategic plan for our agencies, synagogues, and our other community partners. In other words, for our greater Metro West community. So I hope you will be our partner and participate in the task forces as we grapple with the challenges and opportunities that this community study has presented. As Ben said before, and I'll say again, if you have any additional questions, please feel free to reach out to Ben, to me, to Dov, to Cheryl Perlstein, or anyone you choose. Thank you for attending this session tonight. And we appreciate your ongoing support and, seriously, almost more importantly, your involvement in this process, because this is about all of us. This is about the trajectory of our greater Metro West community. And it's a very, very exciting time. So thank you, thank you, thank you. Good evening. And I went 1 minute over I thought I would go. So not so bad, guys. Any additional questions, feel free to call, shoot me an email. Okay. Thank you, everybody. Thank you, Len. Thank you, Janet. We'll see you guys soon.